to provide some good news for a change as it relates to just the rough year we've been having as a result of this global pandemic. As of today in San Francisco, our case rate is at 261 cases per day, and that's down from a high of 372 cases per day. Our hospitalizations are at 194, and sadly, 293 people in our city have lost their lives due to COVID. Our infection rate is below 1. We're at 0.95, and our ICU capacity is stable at about 26%. The good news is we are in a better place than we've been in a long time. And today, we got some even better news from our governor, who announced the lifting of the stay-at-home order in the Bay Area and in the state of California, but more importantly in the Bay Area because that pertains to us. We anticipate that tomorrow we will be told that we will be in the purple tier, which provides us an opportunity to do so much more than we have been doing. The fact is, we got here because after the Thanksgiving Day holiday, we saw the numbers begin to creep up aggressively. And we shut down early because we were very concerned as to what this would do to our ICU capacity in the city. If we had continued along the pace that we were going and did absolutely nothing, at this time, the end of January, we would be out of ICU beds. And because we acted quickly, and because you followed the healthcare orders that were provided by the Department of Public Health, we did so early, even before the state required us to do so. Because we did that in San Francisco, we are in a better place. But we're still in the midst of this pandemic. We still have a responsibility. Yes, this is good news that we are finally seeing a difference with our numbers, but there's still work to be done. It still means that we have to wear a mask and we have to socially distance ourselves from one another. We have to just use common sense and continue to just accept that we are going to be living with this for some time, even as we see the numbers decline, even as we reopen, and even as we start to administer even more of the vaccine than we already have. So what does this mean? What does this mean in terms of our reopening? Well, as I said, it's good news. So outdoor dining can resume. Personal services can resume as long as you can wear a mask. So you can get your hair done, you can get your nails done, a number of things with personal services as long as you're able to wear a mask. This will start on Thursday. Outdoor museums and zoos, outdoor entertainment like skate parks and mini golf, indoor fitness limited to one-on-one, indoor funerals for up to 12 people. So these are things that were not happening before and will be in effect as of this Thursday, again, thanks to all the hard work that we all have been doing to stay safe. We're also going to see some capacity increases in our grocery stores and in retail, and in outdoor fitness and outdoor religious and political events. Outdoor recreation and some low-contact youth sports can resume as well. Golf and tennis with people outside of your household, and small gatherings of up to 12 people, no more than 3 households per group. And what we're saying again, because we remember not this past weekend, but the weekend before, we saw so many people at Dolores Park, at Alamo Square Park, at parks throughout San Francisco. And we saw them gathered with large groups. There were, of course, a lot of people who were just following the rules and keeping their distance, but we did have some real challenges. Today's a beautiful day. Yes, it's cold outside, but the sun is out. Just keep in mind that this is just not an open door for us to all of a sudden let our hair down and do whatever we want to do. Let's keep doing what we're doing. Let's keep being smart about wearing our mask and who we interact with. Let's limit the number of people that we interact with so that we can make sure that we don't see another surge and see this virus continue to get out of control. Today is, of course, a day of celebration, but it's also a day to just remind ourselves of the importance of how much more work we have to do to get to a better place. Now, I want to talk a little bit about the vaccine. We in the city have developed the capacity to ramp up to 10,000 doses a day. Now, of course, we want to do more than 10,000 doses a day if we have the vaccines. This past Friday, I was at City College, where they first started to administer doses there. They've been able to administer over 1,600 doses so far, and that site alone has the capacity to deliver up to 3,000 doses per day. We also have a site that we're opening at Moscone and in the Bayview Hunters Point community, where there will be large sites in partnership with our private healthcare providers so that we can get to people sooner rather than later. Our goal is to also make sure that we're doing pop-up sites in neighborhoods and communities that have been most impacted by the virus. We want to meet people where they are. We want them to feel comfortable when they get the vaccine. And so as soon as we get the number of doses that we need to start to administer, we will do just that. I will say that there's been a lot of misinformation. There's been a lot of criticism and that has surfaced over the course of the rollout of delivering the vaccine to people. And I just want to take a moment to talk a little bit about what we've been doing here in San Francisco. In fact, when we first found out about what we would need to administer the vaccine, including the freezers and all the other technical stuff, we learned that information back in August, and we instantly prepared for that because we knew that in a place like San Francisco, with the number of people we have both living and working here, we would need to make sure that we had the capacity so that when the vaccine was delivered to us, we had the refrigeration necessary to basically keep those vaccines ready to go for people before they were distributed. The work that went into the infrastructure, working with our private healthcare providers, and just understanding what needed to be done in terms of traffic coordination, in terms of distribution, in terms of checking information, it is a process. In fact, when I was at the site at City College this past Friday, one of the conversations I had with the doctor is that these vaccines, they have to stay refrigerated at least until the hour before they're actually used. So just imagine the coordination that goes into that alone. This is a complicated process, and I want to be clear that had we waited to start more recently, like some people have said that we did, we wouldn't be where we are now, opening large sites, opening and setting up pop-up sites, distributing the vaccine at some of our community clinics where many of our elderly live and are able to walk to. We wouldn't be in this position had we waited to start. We started last year in the summer. As information came, we adjusted, and we stepped up to the challenge to meet the need. In fact, Department of Public Health specifically, based on the number of vaccines that we have received, we've already have distributed over 2/3 of those vaccines to individuals, and the remaining batch we have are mostly for people for their second dose and are scheduled to be given to others for their first. Those vaccines are coming in the door and they're going out the door as quickly as we can make that possible. So I want to be clear, it is complicated, it is challenging, but this same Department of Public Health is the Department of Public Health that had advised me as the mayor in the beginning of this pandemic that we had to shut this city down so that we could save lives. It's the same Department of Public Health that led the efforts during the AIDS crisis where San Francisco was left on its own. It's the same Department of Public Health that I am working with to roll out the vaccine distribution, because not only do they know and understand the importance of what this means to save lives in San Francisco, I understand the importance of what this means to save lives in San Francisco, to get our city reopened, and to get our economy going again. Nothing is more important. I trust and support and work closely with the Department of Public Health to make the hard decisions to get this vaccine out to the public as quickly as possible. So I want you to understand that we are in a better place. We are not where I want us to be because we don't have sufficient supply of vaccines to distribute to the public, but I will guarantee you that as soon as we get them, they will be out on the streets in someone's arms so that we can get things rolling again. And I appreciate the patience and understanding of so many San Franciscans as we go through this process. Keep in mind, San Francisco has done an amazing job through this pandemic. I know we're tired of being indoors. I know we're tired of the schools being closed and not being able to connect with our friends and family. I'm tired of this too. I understand how important it is to get back to our lives. I understand that more than anyone because I feel the responsibility, the weight of this entire city and every single resident. I feel that on my shoulders every single day. But I'm asking for more patience and understanding and trust that we will continue to do everything we can to get these vaccines out the door. In fact, tomorrow, I'll be having a conversation at 1:15 online with Dr. Susan Phillip and Dr. Navena Baba, who are two incredible women who have helped lead this effort from the beginning so that we can ask questions about, some of the concerns I've been seeing from people who were wondering, well, why is this happening and that's not happening? And why is this going on and why is that not going on? Well, tomorrow, your questions about the vaccine will be answered. And I hope that will instill just really an understanding and also a clear guide for what we are doing here in San Francisco and what we need to continue to do to get the vaccines out as quickly as possible. And I am excited today. I'm excited today because the vaccine rollout. I'm excited today because many of our small businesses will begin to open. I am excited because I know that people in San Francisco, although this is a great day, they realize the importance of still following safety guidelines around COVID and understanding that the virus is still out there and we still have more work to do. But today still is a day of celebration. And I'm again grateful for all of you for everything you've done to get us to this point. Now, the last thing I want to touch upon is we have a new president. I love saying that. We have a new president, we have a new vice president. And one of the first announcements that the president made last week is the fact that our shelter-in-place hotels that have been provided to many of our homeless people who are part of this vulnerable population, that they would not only just reimburse the 75% that they agreed to reimburse at the beginning of this pandemic, this president has committed FEMA to reimbursing us at 100%. And what that does for our budget is incredible. We're still facing a significant deficit. We still have a lot of financial challenges. But what this means is we have a level of certainty. No, this is not going to be forever, but it's going to be long enough where as we start to transition some of the people that we have in hotels in San Francisco into permanent housing situations, we can now backfill those hotel rooms with people who fit the guidelines under the FEMA requirements for reimbursement. That is really great news, and I'm excited to continue to work towards trying to get our most vulnerable off the streets. But I want to be clear about something. If you were not on our list to receive support and care in our homeless system as of April last year, and you basically came to San Francisco thinking that there's an opportunity for you to get help in some capacity, unfortunately, we will not be able to help you. And the people that we'll be able to serve are people who were a part of our system of care before April of 2020. They're already on the list, they're already waiting, they're sleeping outside, they're sleeping in tents, and we are not going to jump the line for someone who just decided to come to San Francisco yesterday. There are people who are waiting, and they will be prioritized, and they are the only people that we can help at this time. So I want to make that clear, that is what's going to happen moving forward with the good news of receiving reimbursement 100% from FEMA. So I want to thank each and every one of you again. Today is a good day. Today is not a day to go outside and throw up your mask in the air and celebrate in that way. You can go out and celebrate and throw your hands in the air and just keep your mask on. Make sure that you're continuing to comply with this health order and doing everything you can. When you go to restaurants, just be mindful. When you visit friends or family, just follow the health orders. We're not out of this pandemic, but we're definitely a lot better today than we have been in a very long time. It gives me hope that we are finally getting to a better place, the place that we continue to talk about, the place where we say we're the light at the end of the tunnel. Well, we're seeing a crack of that light come through bright, and that's because of your work and your efforts and everything you've done. So thank you, and the better our numbers get, the more we will be able to open, the more we will be able to get back to a place where we can see one another in person again. Thank you again, and now happy to open it up to questions.
Thank you, Mayor Breed, for your remarks. Before we begin the question and answer portion, we're going to take a moment to allow reporters to submit any final questions they may have on WebEx. Thank you, Mayor Breed. And at this time, we're going to start with Dr. Colfax.
Okay, thank you again. Dr. Colfax, I'll let you do the wipe down.
Good afternoon.
Thank you for your patience. Dr. Colfax, your first question comes from various media outlets. Why are people from out of the county getting vaccinated at City College?
Well, thank you so much for the question. I think City College has been a great partnership with UCSF, and if we had enough vaccine, we could get to 3,000 vaccines there a day easily right now. So I think some key issues to understand right now is for vaccines, the focus has been, eligibility for vaccine has been for healthcare providers and for people 65 and over. Many healthcare providers work in San Francisco, but live outside of San Francisco. So many of those healthcare providers will be vaccinated here because it's a place of work. Similarly, people who are 65 and over who are eligible for the vaccine, they may live in Oakland, but may have their healthcare provider here in San Francisco. So they would be getting vaccinated here. Vice versa, if you live in San Francisco but a healthcare provider in Oakland, you could go to Oakland to get vaccinated. The issue is, the Bay Area is porous. We're all interconnected. We need to get vaccines into arms as quickly as possible.
Thank you, Dr. Colfax. Your next question comes from various media outlets. Why are we reopening with new virus variants circulating? How will the city deal with new variants and avoid shutdowns?
So we are opening at a high level of case diagnosis. We're at about 30 per 100,000 right now, which, as the mayor mentioned, is substantially lower than we were just a few weeks ago. So this is very good news. We know that the rate of the virus spread in the city is slowing right now, which is also good news. We will continue to monitor the rate of spread, and hopefully that will continue to go down. With regard to the variants, we are concerned about that. but there's no reason to panic. We know that wearing masks, social distancing, and using the good hygiene practices, we believe are also effective with regard to reducing the variant spread. So right now, even with this relatively high rate of cases, because things are moving in the right direction, because our hospital capacity, even through this third surge, remained relatively good in San Francisco compared to other jurisdictions, and the fact that San Franciscans had now beaten back 3 surges, look, we've been in this for nearly a year right now. It is time for us to take this approach of gradually reopening. We are reopening the lower risk activities right now. Let's see where we are. Let's all do the right thing so that we could even get to that next step and open up more.
Thank you, Dr. Colfax. Your next question comes from Heather Knight, San Francisco Chronicle. How many vaccine doses has San Francisco received, and how many has it given to people?
So right now, Heather, we have received as a city 127,000 vaccines. That's across the whole city. That's across the healthcare systems across the city. And we've administered, as a city, we estimate just over 59,000 vaccines have been administered. At the health department, we've received 34,500 vaccines to date, and we've vaccinated more than 23,000 people. Now, in those numbers, I want to stress a couple of things. We are ready to go with mass vaccine sites right now. We need to get to 10,000 vaccines a day. The numbers I gave you also, we need to ensure that with regard to the vaccine that's remaining, those vaccines have been scheduled for second doses, or appointments have been made for first doses for the most part. And with the DPH supply, even with the 10,000 we are told we'll be getting this week, we will be scheduled to basically exhaust our vaccine supply by as early as Wednesday or Thursday. We need more vaccine right now so we can get those shots into arms.
Thank you, Dr. Colfax. The next set of questions come from Alex Barreria, San Francisco Business Times. In what ways will the restrictions in place in San Francisco beyond Thursday differ from what the state is allowing in the purple tier counties? Or is the county reopening to the full extent of the purple tier?
So just to be clear right now, the state has announced that the counties are coming out of the shelter-in-place order. We will be told what tier we are in tomorrow. We'll be looking at that very carefully. And with regard to the orders, those will be released accordingly, and those will be released Thursday at this time.
Thank you, Dr. Colfax. Your next question comes from Polly Stryker of KQED. What amount is the expected next shipment of vaccine in San Francisco? So
remember, we have visibility only into the vaccine that the health department will be getting, because the other healthcare systems in the county, the Kaisers, the Sutter, the Dignity, they get told from their regional counterparts what vaccine they will be getting. What I know right now, what I can tell you right now, because this is what we have insight into, is the health department is scheduled to get 10,575 doses this week. That number could change. We will know that number when they tell us that number has actually been shipped to us. But again, that's ready to go out the door right now. We need more vaccine.
Thank you, Dr. Colfax. The next question comes from Eve Beatty, Eater SF. Can we please hear a little bit more about the thinking behind the decision to leave the 10 p.m. to 5 a.m. stay-at-home order in place?
So what we're doing right now is working to gradually reopen the city. We're taking the initial steps in a situation where the rate of the virus is still relatively high. We want to see that number continue to go down before we release that 10 to 5 order. So let's just give us a little more time and see how those numbers do to ensure that we don't have to reverse again. Nobody wants to go backwards again. So let's take this first step. We've beaten back 3 surges. let's prevent a forced surge as much as possible.
Thank you. The next question comes from Christian Kaftan, KTVU Channel 2 News. How will this work county by county when the entire Bay Area was covered under the state's previous order? Could there be surges in other counties that could impact San Francisco?
Well, I think what's been really great about the local county collaboration for this nearly year, well, actually a year now, is the Bay Area health officers have been coordinating and working together, and for the most part, the region has been well coordinated. So again, we will see what tier the counties are assigned to by the state tomorrow, and I expect that in general, the county orders will be aligned for the most part.
Thank you, Dr. Colfax. Your next set of questions come from Dan Kerman, Cron 4. Who is getting vaccinated at City College? Those in the San Francisco Health Network, those in the UCSF Health Network, or anyone over 65?
So people who are eligible for vaccine right now are healthcare workers and people over the age of 65. Right now, that site, those patients are UCSF patients who, for the most part, meet the 65 and over criteria. But again, once we get more vaccine, we're ready to go give up to 3,000 vaccines at that site alone.
And a follow-up question, do you feel as if the feds are sending less vaccine to the Bay Area region compared to Southern California due to the massive outbreak there?
So I'm not going to speculate on what the feds may or may not be doing. I think the bottom line is across the state, regionally and locally, we need more vaccine as soon as possible. San Francisco is ready for more vaccine. Our goal is to be able to inoculate at least 10,000 people a day. And as you just heard, the health department's only getting just over 10,000 doses this week. So we need to get that vaccine here so we can get it into arms as quickly as possible.
Thank you, Dr. Colfax. And we will now continue questions with Mayor Breed.
All right.
Mayor Breed, your first set of questions come from Bigad Shaban, NBC Bay Area. What do you say to landlords who feel they're being taken advantage of by tenants who continue to pay $0 in rent and intend to continue living rent-free during the eviction moratorium?
Well, I appreciate the question. And, you know, San Francisco, since the beginning of this pandemic, through not only the rental subsidies that we had through the City and County of San Francisco, but Give2SF, had tried to provide some additional rental assistance to make sure that when this is over, people are still responsible for that rent and will need to pay it. We just found out from the federal government that San Francisco will be given $26 million in stimulus money to help with rental assistance. This will be significant. We know that it's not just the people who are struggling to pay their rent, but some of the small property owners and others who might be struggling because they're not receiving that additional income. There is hope with this new $26 million, and I'm excited to see what that does to help address some of the challenges that exist, because what we don't want to happen is we don't want, after this pandemic is over, we don't want to see a lot of people getting evicted, and we also don't want to see a situation where so many small property owners who rely on this income to help cover the expenses of maybe their in-home support services work or the repairs on their home. We don't want to see them in a bad situation either. So right now, great announcement, $26 million in rental subsidies. That's a start. We know there's more to do, but I think we're going to continue to work towards the goal of trying to make people as whole as we possibly can.
Thank you. And a follow-up question from Bigad. Should future stimulus checks include a requirement that a portion of those funds go towards a person's rent? How can smaller landlords afford to keep allowing renters to live for free?
I think something of that nature might be somewhat difficult to manage. I know that, for example, we have the ability through the resources we provide for rent subsidy to make direct payments, which ensures that these resources go directly to cover the rent. On a federal level, I have no control over that, but I do think it's important for us to do everything we can to make sure that we get direct payments into the hands of landlords to make sure that we avoid the evictions that could occur if these rents are not paid.
Thank you, Mayor Breed. Your next question comes from Ron Lynn of the Los Angeles Times. Some restaurant owners have been very upset at the outdoor dining ban and have opposed government orders to shut them down. Do you think San Francisco's latest success vindicates your efforts to impose an outdoor dining ban and implement stay-at-home orders even ahead of the state's timeline?
Well, I truly believe yes. If you got to understand, to close down a major city like San Francisco, and then also when you see the numbers surging and to have to go backwards, those are some of the hardest decisions I've ever had to make, because I know what it means, not just for the people who are supporting these restaurants. I know what it means for the workers and the food and all the things that these restaurants have to do to be open in the first place. But the fact is, we had to prioritize saving lives in every decision that we made. And what we're seeing are the impacts of those decisions because our case rates are the deaths that are the lowest death rate in the country of any major city in San Francisco. The ICU rates, I think all of the numbers that we are seeing in San Francisco demonstrates that we made the right decision. And now that we are reopening outdoor dining, we want to continue to make sure that we are being very careful because we don't want to go backwards.
Thank you, Mayor Breed. Your final question comes from Kathy Novak of KCBS. With the extra funding from the federal government, will San Francisco be able to open up more hotel rooms to people who might not qualify for FEMA reimbursement and cover the cost out of the city's budget?
Well, we are not certain that that's going to be possible because our goal is to provide permanent housing, not temporary housing. And what these hotels and these safe sleeping sites that we opened during this pandemic have done is provided temporary shelter for the people who unfortunately are homeless, and we're being reimbursed for that purpose. But our resources, the money that we have in available to assist with our homeless population, need to be used for permanent housing options, and that's where our priority will be.
Thank you, Mayor Breed. There are no additional questions.
Thank you.
This concludes today's press conference. Thank you, Mayor Breed and Dr. Colfax, for your time.